Bismillah ar-Rahman ar-Rahim. Cystic fibrosis and diabetes. Cystic fibrosis related diabetes affects at least one-third of adults of cystic fibrosis patients and associated with higher morbidity and higher mortality. Pancreatic damage in cystic fibrosis due to fibrosis causes decreased insulin secretion. And cystic fibrosis related diabetes is a distinct type of diabetes but shares certain clinical features of both type 1 and type 2 diabetes. Unlike type 1 diabetes, onset of the diabetes due to cystic fibrosis is usually insidious and patients may be asymptomatic at diagnosis or patients with decline to pulmonary function or weight. And ketoacidosis is very rare. Cystic fibrosis related diabetes differs from type 2 diabetes in that weight loss is often an early feature and reactive hypoglycemia is not unusual. And some patients exhibit over diabetes during an infective exacerbation but returns to normal. Glucose tolerance later. Early identification and treatment of cystic fibrosis related diabetes improves health status even in the absence of fasting hyperglycemia. We should do oral glucose tolerance tests annually and also monitor glucose, which is increased during screening and monitoring cystic fibrosis related diabetes. The management of the condition is with use of insulin, usually as basal bolus regimen with blood glucose targets of 4 to 7 millimole per liter. And we should note better that there is no rule for oral hypoglycemic or a hypoglycemic diet. Microvascular complications can occur after 5 to 10 years of cystic fibrosis related diabetes. So again, the management of cystic fibrosis related diabetes is insulin. There is no rule for oral hypoglycemic medications and there is no rule for hypoglycemic diet.